Welcome to this in-depth exploration of America's mental health crisis. Our focus will be on this often overlooked aspect of our society, which, despite its pervasiveness, lays beneath the surface, hidden from the mainstream spotlight. However, its impact on our daily lives cannot be overstated. We will delve into the reasons behind this mental health disaster, untangling the web that has been weaved and examining possible solutions. Let's start with some sobering statistics. Over the past decade, the rates of anxiety and depression in America have been on the rise. In fact, it's estimated that mental health conditions affect 1 in every 5 American adults. That's a significant portion of the population struggling in silence, their battles unseen and unheard. The challenges these individuals face are immense. In a society plagued by taboos and stigmas, mental health care is often an elusive concept. The fear of judgment, of being labeled crazy or weak, can lead individuals to hide their struggles, pushing them further into isolation. Stigma, however, is not the only obstacle. For many, the barrier to accessing mental health care is a financial one. Limited insurance coverage and high out-of-pocket costs often place essential services out of reach, leaving many without the support they need. Then there is the issue of resources. Too many communities lack the necessary clinics, hospitals, and professionals equipped to address the growing demand for mental health care. Even the most dedicated of professionals are stretched thin, their capacity insufficient to meet the needs of the communities they serve. The situation is further complicated by the insidious link between mental health issues and other social determinants, such as poverty, racism, and discrimination. These conditions can exacerbate mental health symptoms, contributing to a vicious cycle of hardship and suffering. Making matters worse is a lack of public awareness about mental health and the factors contributing to the crisis. This has enabled the perpetuation of myths, misunderstandings, and misinformation, further shrouding mental health in a cloud of ignorance and uncertainty. However, there are signs of hope. In recent years, there has been a growing societal interest and willingness to address mental health challenges in a more profound way. Policymakers, advocates, and mental health professionals are increasingly working together to develop solutions that can help break down these formidable barriers. Promising measures have been proposed to address the crises in both the short and long term. In the immediate future, efforts to expand access to mental health care and to make services more affordable are moving forward. Long-term strategies have centered around improving education, reducing stigma, and providing targeted help for specific at-risk populations. By addressing these systemic issues, advocates hope to create a foundation that will help all members of the community achieve better mental health. So where do we go from here? It's clear that addressing the mental health crisis demands a comprehensive, multi-level approach. We have to challenge stigmatization, improve access to care, foster understanding, and promote mental wellness. Only then can we hope to make meaningful and lasting change. The path forward is complex, no doubt, but it's also filled with potential. As individuals, one of the most impactful things we can do is to become more aware, more informed, and more compassionate. By creating a supportive environment and encouraging open dialogues, we can contribute to a culture that values mental health as much as physical health. As a society, we must support and amplify the voices of those who live with mental health challenges. Their experiences are valuable insights into the reality of this crisis and provide a roadmap for much-needed change. Advocacy and policymaking are areas where we can greatly influence change. By demanding legislation that prioritizes mental health, we can create systems that support and protect those who need it most. As we conclude this exploration of America's mental health disaster, remember that change can only occur when we recognize the reality of the situation and accept that we all have a role to play. Let's take a step forward for our friends, loved ones, and ultimately for ourselves. As we enter a new era, we must continue to question, learn, and act. Together, we can dismantle the systems that perpetuate this mental health disaster, turning it into a tale of resilience, empathy, and lasting change.